Hello and good afternoon. Thank you for joining today's webinar. Today we'll be discussing our Medicaid Advisory Committee and Beneficiary Advisory Committee, also known as our members, and getting input to improve North Carolina Medicaid. I'm LaQuana Palmer. I'm the Deputy Director of Communications and Engagement. And again, we thank you for joining us. For today, we'll have closed captioning that is available for our webinar in both English and Spanish. To view the captions, please make sure that you click the gear icon in the bottom right-hand corner of your screen, as shown in the first picture. Choose the captions/subtitles option in your preferred language. Today's slide deck and recording will be available on our website tomorrow, and all of the web links referenced in the presentation will be accessible within the deck. Please use the Q&A feature to ask questions and provide comments. We will try to answer as many questions as possible at the end of the webinar. Again, thanks y'all for being on. We're so happy that you could join us today. We have a lot of information that we would like to share with you all. This is an exciting and new opportunity. I think that some of you are used to seeing what we have called our MCAC. We will now have 2 new programs. We're splitting that up. We're bringing something new that has come down from our Centers of Medicaid and Medicare Services to make sure that you have the opportunity to now join either our Medicaid Advisory Committee or our Beneficiary Advisory Council. After today's informative overview of all of this new information that's coming out about the programs, we will make sure that we will take questions from you all. As a reminder, please use the Q&A feature that was discussed before to make sure that we answer all the questions that you have for today. Now, I'd like to introduce you all to Kathy Batten. She is our Communications Manager for NC Medicaid Communications and Engagement. Kathy has spent a lot of time learning about the new policies that came down from CMS, and is now taking the opportunity to not only work with you all today during this webinar, but to also work with other groups throughout the community to make sure that they know about this new opportunity. So Kathy, thanks for joining us today. And later on, you'll hear from our Medicaid Deputy Director, Melanie Bush, and she'll also give you some greetings and let you know more about how important it is to make sure that you join these 2 new committees and council. So Kathy, I'll hand it over to you.
Thank you, LaQuana. I am happy to be here, and I am very excited to share the new programs that we have coming. These changes are due to a CMS final rule that was released in April 2024, and they titled it Ensuring Access to Medicaid Services. The intent is to create venues that Medicaid, state Medicaid, can get input from people with lived experience with Medicaid. The new rules require us to create 2 new groups, a Beneficiary Advisory Council, which we refer to as the BAC, and a Medicaid Advisory Council, which we refer to as the MAC, by July 2025. They're designed to center the lived experiences of beneficiaries, their families, and caregivers, as well as give a more formalized structure that will allow beneficiaries and interested people to provide feedback to the state about Medicaid. The MAC will replace the current Medical Care Advisory Committee, the MCAC, that currently advises Medicaid on health and medical care services. MCACs have been around for around 40 years, so this is a big change coming from CMS. Next slide. CMS has given us guidelines as to what the MAC and BAC will provide insight to us on. These are topics related to program operations and the needs of beneficiaries, and they can include additions and changes to covered services, coordination of care, quality of services, eligibility, enrollment and renewal processes, beneficiary and provider communications, access to services, cultural competency, language access, and health diversity, as well as other issues that might be identified that are impacting health and medical services. Next slide. So the MAC, the Medical Advisory Committee. The MAC will be made up of a diverse group of Medicaid stakeholders with a wide range of perspectives and experiences. In addition, the MAC will include BAC members and at least one representative from each of the following categories: clinical providers, administrators, participating health plans, state associations, other state agencies as ex officio members, and state, local, or community-based organizations. Next slide. The membership will be composed of at least 20 members, with members selected from the 14 congressional districts and 6 additional at-large members. As I mentioned before, the MAC must include a portion of BAC members, and CMS is doing this in a phased-in approach. So by July 2025, 10% of the MAC must be BAC members. Then next year, the following year, 20%, and then 2027, the final of 25%. BAC members can rotate on the MAC, so they don't have a burden of serving on the MAC as well as the BAC. Next slide. This is where things get interesting and exciting. The BAC will be a dedicated forum for people with lived experience with Medicaid. BAC must include current or former Medicaid beneficiaries, family members of beneficiaries, paid or unpaid caregivers of beneficiaries. This is truly the forum for beneficiaries to have input. The BAC shall be composed of no more than 18 members, with members selected from the 14 congressional districts and 4 at-large members. We have the ability to build the MAC and the BAC to meet unique features of our program. So CMS requires that by July 2025, we must have bylaws and a recruitment facilitation process in place. This will include member selection criteria, and it must be on a continuous and rotating basis. Onboarding, term lengths, we're looking at 3-year terms, realizing that the first iteration will be staggered terms so that we don't lose everybody at one time. In addition, members cannot serve a consecutive term, but they can serve multiple non-consecutive terms. We'll determine how members roll on and off, compensation, and we can adapt existing committees to meet the requirements of the BAC and the MAC as long as the existing committees meet the current requirements, and we publicly post in our bylaws that this group is being used to fulfill the MAC and BAC regulatory requirements. Next slide. Both the MAC and the BAC will meet once a quarter and will hold off-cycle meetings as needed. The BAC is to meet separately from and before each MAC meeting to ensure that the BAC members are prepared to participate in the MAC meeting. We must offer rotating meeting participation options, which include all in-person, virtual and hybrid, which is virtual and in-person attendance. Regardless of the meeting format, a telephone dial-in option must always be available to members. 2 MAC meetings each year must be open to the public with dedicated time for public comment. Once the BAC is established, it will decide for itself which meetings, if any, are open to the public. This is designed so that members of the BAC feel empowered to give their opinion and thought without being worried that others will identify them. It is their option whether or not they want to be noted. Next slide. As with the MCAC, we will be required to publicly post a MAC and BAC, oh, this is new, sorry, a MAC and BAC annual report. This is new, and we will need to do this each year. With the help of Medicaid, we are required to submit an annual report that describes the activities of both the MAC and the BAC, topics discussed, recommendations, and the state's response to the recommendation. In addition, we will be required to post bylaws, membership lists, member recruitment selection processes, and meeting minutes. The membership list, again, if members of the BAC do not want to be noted, they do not have to be. Next slide. Recruitment. And this is where we are today. The recruitment process must be open to the public. MAC and BAC members will be selected by the Deputy Secretary of Medicaid. People who are interested in joining the MAC and the BAC must submit an application for review by Medicaid. In the application, members must describe their interest in the Medicaid program and why they feel that they could be of service to the committee or council. We must ensure varied representation on the MAC and the BAC. For example, enrollees with different demographics or healthcare needs, different provider types, which is one of the reasons that we are choosing to have people from each congressional district. This will allow us to make sure that geographically we have equal representation. And in the application, there will be questions that people can choose to or not to answer, but it will help us to ensure inclusiveness and diversity. So where we are now, we have developed an application. We are getting ready to publish it and recruit members. Then we will review applications and select members. The publish and recruit is where we're kind of at an unknown. We certainly hope there is a lot of interest in the MAC and the BAC, but we are starting early to ensure that we have time to pull together a good working group for both the MAC and the BAC. We will be actively sharing information about the MAC-BAC and recruitment, and will be open to speaking, giving information, providing information to anyone, because we want to make sure that we do a good job of getting a good representation. The committee also knows that the western part of North Carolina is still struggling, and we realize that it may take us a little bit longer to recruit in that area and have made allowances for that. Next slide. So how can you apply? We have a online application available in both English and Spanish. We have a paper application that people can download and print, also in English and Spanish. And for those that need assistance, if they email the email address noted, we will be happy to work with them on the phone to take their application. These links, when the slide deck is sent out, will be active so that you will be able to share the links, apply for yourself, send information, etc. I know I went through a lot of information fast. We, as I said, are currently focused on introducing the MAC back, the changes that are coming, and recruitment. As we get the first phase, I call it, complete, we will move into the second phase of looking at meetings, what will be discussed, getting down into that type of detail. I will tell you, we are one of the first states to be this far. So we're kind of learning as we go, and probably will be teaching others. We do not have all the answers yet. We're still trying to clarify certain things, but it is an exciting time, and I certainly hope that you all will take an interest, share the information, and help us to make this a success. And now I'd like to introduce Melanie Bush. She is our Deputy Medicaid Director, and she will say a few comments. Thank you.
Thank you, Kathy. Good afternoon, everyone. I am very happy to be here. I think this is an exciting opportunity for the Medicaid program. When I started back at North Carolina Medicaid in 2011, the MCAC was all but dead in terms of their role for the Medicaid program, and we were able to revive it and engage providers and Medicaid beneficiaries on how we were going to cover budget shortfalls at the time. And it was really an impressive effort to hear the perspectives of all of the folks that are impacted directly by the Medicaid program. And that's why this is so exciting. It does put more of a focus on the beneficiary and people with lived experience in navigating the incredibly complex Medicaid program that we have today. This final rule is a huge shift. As Kathy mentioned earlier, we had the MCACs for 40 years, but there weren't a lot of real strict rules around it. And so sometimes they died, and sometimes they were revived, and sometimes they operated as a board of directors, and sometimes they never met. And so CMS is really taking the opportunity with this rule to sort of standardize the process across all Medicaid programs. We really want to encourage everyone who may be interested. It is a time commitment, I understand, but we do need to hear more about how people are living with Medicaid. We have been so heads down here, implementing a lot of things in the last couple of years, managed care, Medicaid expansion, tailored plans. We try to seek out beneficiary feedback and stakeholder engagement at every opportunity, but this is a standing quarterly opportunity for folks to do that, and we really want you to be at the table and to make your voice heard. We're going to be talking about things that beneficiaries may want to weigh in on, things like what services are covered or health-related social needs. Why is eligibility so confusing? Barriers to accessing care, things that folks do tell us about when there is a problem, but we want to hear more about trends and what you're hearing from in your communities. Please take the opportunity, if you are interested, to join us by applying to be on the MAC or the BAC. We really need to hear your voice here at North Carolina Medicaid, and I just want to thank everyone in advance for your engagement and your participation. Thank you. I think I'm turning it back over to Laquana.
Thank you, Melanie. All right. As we stated previously, we do have time to take any questions. We have a number of questions. I've been in the background answering a number of those questions just to make sure that if there's additional information that you all need, that we can help you out with any of those questions. Again, we do have the Q&A section, so feel free to drop in any questions there. So far, we have received a number of questions you may have seen come through so far. One question that was asked is, can you be in MAC and BAC at the same time? The answer is yes. You can serve as members of both. Again, we are accepting applications for both, so you will have to apply for both. Another question that we had is, if there is someone who is currently a member of a CFAC or a member of another committee, can they serve as a member of these committees? Yes, you can serve on other committees. There are other committees that exist throughout the state and within state government. You can serve on those committees. Again, just we are hoping that you apply for either the MAC or the BAC. We have also been asked if about the terms, and they were wondering if a member of the BAC, if they are no longer able to serve, 1-year terms. And as Kathy just shared, we have now moved to 3-year terms. And so instead of having a 1-year term, there will now be 3-year terms. So thank you for that question. Kathy did share that if you have a question and it wasn't answered today, feel free to make sure that you reach out to medicaid.engagement@dhhs.nc.gov. It's up across the screen right now, so feel free to send any emails there if we do not get your question answered today. We have another question that has come through and asks if a provider that obtains a PA for PDN services, what committee am I best fit for? We would say MAC, the MAC. Please apply for the MAC. If you are a provider, we encourage you to apply for the MAC. We also have one that states, as a current Medicaid beneficiary that has been solely responsible for the health care of other family members that were previously or currently enrolled, that also have been unpaid caregiver to another non-family beneficiary, how do you determine which category to apply under? We would encourage you, if you are an individual who is responsible for the health care of a family member, we encourage you to apply for the BAC, the Beneficiary Advisory Committee, or the Beneficiary Advisory Council. We are looking for not only just members or beneficiaries, we're also looking for those caretakers or caregivers of those individuals who love them. And so, yes, please apply for the BAC. Can someone be on the MAC as a CBO and BAC as a parent? Yes, you can serve as a member of the MAC and the BAC. So we encourage you to apply for both. Another question that we have is, when will the application process begin? Kathy, please remind me of the date of when those applications begin. Feel free to come off mute.
We will have the website live and the application links later this afternoon. We will be sending out the slide deck to everyone, and we'll include those links so you can go ahead and apply now, share with others. And if you have any questions, let us know.
All right. Sounds good. All right, we have more and more questions that are coming through. We'll answer just a few more. And so one of the questions we have, and I think this is a really good one, and it says, what does the feedback infrastructure look like in the MAC in the back in terms of closing the feedback loop in response to committee concerns? Great question. When we are receiving questions, not only just questions, we are hoping to receive topics. We are hoping to receive, again, just information that is going to help us not only look at just the infrastructure of how we're responding to questions out in community, but we're looking to see how we can accept those questions, receive the information that is coming from the council and the committee, and take that and apply that to many of our different meetings that we have within our internal meetings for Medicaid to help us with being able to make sure that making changes to our policies. So we have policies, lots of policies that come down from Medicaid, from CMS, and we need your feedback on how is that impacting your families, your organizations that serve these families that are using Medicaid services. And so it is important to make sure that we receive that feedback. Again, that loops back to, I'm a member of the executive team. You have Melanie Bush that's on, Jay Ludlam, who is a member also of both, will be a part of the MAC and the back as well. It's important to make sure that our deputy secretary takes that information back and is, again, able to meet with our leadership teams to then make changes according to the feedback that we are receiving. That is one of the biggest reasons why the CMS decided that they wanted to make sure they have these two new committees, to make sure that it's not just information we're receiving, we're just sitting on it, that we're actually receiving that information and we're using that to make a difference. So it's important to make sure that we have that loop. And then when information does come back as to what changes will be made, that we can report that back to both of the committee and the council. So I'm hoping that that helps. We received another question, and I think this may be one of the last questions of today, unless we have more that we can get through. And it says, thank you for today's webinar. I saw that the question about dual membership on the back and the MAC and CFAC. Do you all anticipate cross-pollination of stakeholder feedback between the back and the state CFAC or the local ones? This seems like an opportunity for synergy. Yes, we agree. As a matter of fact, we have Kathy that will be attending the state CFAC meeting this month to go and talk about the MAC in the back and the opportunities to be able to have that synergy there. So yes, we absolutely agree that yes, there may be some cross-pollination that may be there, or we may be getting totally new members that we have not seen a part of our work before. Again, we see this as an opportunity that will open up a chance for folks that maybe we haven't seen before and give them a voice to be able to be a part of this council and committee. So again, there may be some pollination or cross-pollination that happens there. We open and we welcome that opportunity because there are many voices that are right now on not only the state CFAC, but on the local level as well, that have many voices that will be more than willing to share and help with making sure that we are, again, taking that feedback back to Medicaid and making sure that that is being, I would say, crossing to a lot of the work that is going on and may come in the future. We have lots of work that is happening that's coming up in the new year that is going to require a lot of feedback from community. So we are looking forward to having many of you all apply and be a part of that. Let's see. Will the MACBAC have access to interact with the General Assembly or health committees? At this time, no. Not direct contact. However, we do have, again, our deputy secretary who interacts with those health committees. And if there is feedback that we receive from our councils or committees that needs to go to the General Assembly, that is our spokesperson who will take that information forward. He is one that does like to make sure that he hears real voices in real time so that he can be able to share that as he continues to push for agenda items that come our way. And so to make sure that your voice is heard and he could serve as that representative for us, we want to make sure that if there is something that is presented to whether the MAC or the BAC, the Medicaid Advisory Committee or the Beneficiary Advisory Council, that we do make sure that we do push that forward. So direct contact, not through the MAC and BAC, but again, it would happen through our deputy secretary. And then I said one or two more, but there's such great questions. I want to make sure that we get these answered. What entities are considered interested parties for the MAC and the BAC, if not beneficiary or caregiver? Are any entities excluded due to COI or at this point, we will have to look at that by application. We don't know exactly what may be a conflict of interest. We'll have to take that in as we continue to look. When we consider an interested party, those are individuals who are interested in the work of Medicaid. They're interested in access to healthcare. They're access to services that help with ensuring that individuals are able to link to care. So those individuals are, again, if you are a beneficiary or you are a caregiver or a caretaker, you may be interested in being a part of the BAC. But if you are a community organization who doesn't necessarily give direct services, but you're interested, again, in being involved, again, just direct policy and hearing more and being able to give feedback to policy that is being developed by our North Carolina Medicaid or NC Medicaid, you may want to look at that MAC. So if you are a CEO, you're part of a health system, you're a health provider, again, you may be a CEO, or again, you may be a community member who is just interested in making sure that you're able to give a voice to this work. We encourage you, either one, but definitely I would say the BAC. If you are a caregiver, you're a member, you're a beneficiary, you're a caregiver, lean more towards to the BAC, but you do have the opportunity to apply for both. But again, all others, you want to consider the MAC. Oh goodness, and the questions are still flowing. Kathy, I just want to do a time check to see how much more time do we have for today.
You're good, Laquana.
All right, we're going to keep going. All right, we have another question that has come, and I am going. There is something that just came through there, said it could be a strategy to have a formal connection between the state CFAC and the BAC. That came in as a question, and we'll take that back. We do have some of our, Suzanne Thompson, who is working very closely with the CFAC and works closely with our office. So making sure that there is some more formal work that happens there, we'll be able to work towards that as well. But I could see that in the future, and that's something we can take back. As far as additional questions that are coming in, what is the deadline for application submissions? Kathy, what is the deadline?
We're hoping to get all the applications in by mid-December. Again, this is new. That could change if we don't get the response that we're looking for. And as I said, we will be extending time for those in the western part of North Carolina. So it's kind of a fluid answer as we figure out how things are moving.
All right, thank you. So someone is asking for a point of clarification, and that point of clarification, it says that wouldn't members of a MAC or BAC need to be a member of the Medicaid health insurance plan? If you're a member of the BAC, you need to be a member of Medicaid or a caregiver, caretaker, a family member of someone who is receiving Medicaid benefits. If you're interested in being a part of the MAC, you do not have to be a member or a beneficiary or a caretaker or caregiver or a family member of an individual who is receiving services. So just to be clear, if you would like to be a member of the MAC, you do not have to be a beneficiary or a connected member. So again, these are great questions. Another question that's come in is, do you envision convening work groups based on the different topics of support for the MAC and the BACs? In other words, a work group for all things related to health equity, cultural competency, language access, or work group to focus on working relationships with providers, especially those providers who do not get Medicaid reimbursement, or a work group just to focus on recruitment and technical assistance for MAC and BAC members, those kinds of questions. That is an incredible question, and that is exactly what we're hoping to do. Whether you are someone who is interested in working with our long-term support services, if you are a provider who, again, is interested in looking more into what are some of the ways that we can consider health disparities, or what are some of the ways that we're looking at competency, cultural competency, language access. Again, these are great opportunities. And this will be something that, as we not only form these groups, that the groups and the members of these groups will have opportunities to be able to have subgroups and subcommittees to help with being able to address these issues. Again, we are the conveners. We are helping with developing and putting the group together. But ultimately, when this group does develop, they'll have the opportunity to really grow and decide, and we'll even get feedback from even other Medicaid members that are working with these community members to decide on what is the need, what are some of the focus areas that we want to really dig into. So as we develop these groups, this is something that we're hoping that we'll be able to take a look at and be able to grow, to be able to go in these different directions. Because again, it may be a provider who is interested in these things. It may be, again, a caregiver or actually a member who's interested in these groups. So again, we welcome the opportunity to have these subgroups as these groups continue to grow. All right. Will program managers, i.e. LME or MCO or standard plan providers, be involved? They are welcome. Hopefully we didn't leave them out. If you are a member of a LME, MCO, or health plan, we welcome you. You're absolutely invited to apply and submit your application. Another question that we have is CMS requiring that the state reports back the findings and the response and solutions to the voices of community meetings? Yes, we have an annual report that we have to send. And so, yes, we will have to report back what are our findings, what are the things that are being lifted. We did have the opportunity to attend the National Association of Medicaid Directors conference last week, where CMS was in the room. And a lot of the questions that we had that were related to this MAC in the back were, hey, this is being developed at the state level, but how is this going to be lifted up to the federal level to make sure that the voices that are being developed and put together and have the opportunity to bring these topics forward, how is this going to be able to lift up at a federal level? And so we're hoping, and they took that back with them to think about exactly how will they be able to take this feedback that are receiving, the findings that they're getting from the state, and how this will elevate and escalate to that federal level. So that's something they've decided to take back, and they're working on in real time. So another wonderful question. All right. Are other non-clinical / beneficiary stakeholders able to apply and participate in the MAC back? For example, public health or policy professionals? Yes, you are. If you're a policy professional, if you are a member of our public health, DSS, our aging adult services, yes, please, we encourage you, please apply the MAC. All right. Has the compensation structure for the BAC or the BAC affect Medicaid eligibility? Those are questions that we have been asking in real time. And that is something that we are still hoping to determine. At this point, we are saying yes, because that is a form of income. And so that's something that we will be paying close attention to. However, I will state that compensation structure is still being developed with our finance team. So that is something that we are working on. But yes, when you are receiving any type of income or compensation, that is something that is applied to your income. So because you will be receiving compensation to be a part of the MAC or the BAC, that is something to keep in mind. Eligibility is determined by income. So those are things that you would still have to watch. If we don't get on the BAC, how do we still get concerns addressed? Even if you are not a member of the BAC or the MAC, these meetings will still be open to the public. And so those committee members and those council members will still want to hear from you. They'll still want to know what are you still facing as you continue to receive access to health services using your Medicaid benefits. So we still want to, again, hear from you. So although if you are not selected to be a part of the MAC and the BAC, again, these are public meetings and you will still be able to be a part of the meetings, but not as a member.
Laquana?
Yes.
Can I just make one statement?
Sure.
The MAC will be an open meeting with time for public comment. We're not sure about the BAC yet. That is up to the members if they want to have the meeting open to the public.
Okay, sounds good. You heard it from here. If you the MAC or the MAC, that will still be open. The BAC, they will determine whether or not they want that open or not. So those members will make that determination on if they want to move forward to having an open forum. All right. Could being a DSS Medicaid caseworker be considered a conflict of interest for the MAC? Not for the MAC, but possibly for the BAC. Yes. What retention mitigation will be in place should members become unavailable to participate for the entire 3-year term? 3 years could be a substantial commitment that may discourage beneficiaries from applying. We still encourage members to apply. We recognize that things happen. Life is lifing right now. And if there are things that come up and a person is not able to serve their full term, that's something they will be able to bring forward to us, and we'll be able to then publish and say that a seat is available. But we're hoping that that person would be able to serve the full term. Again, we are hoping to still have the compensation that's available to compensate for the time that's being spent. But we do recognize that 3 years is quite a long time for some individuals. And so we'll be able to work with that person to see what is going to be the best way to be able to serve as that person continues to have an interest. And the next question is further, what about beneficiaries who were later determined as no longer eligible? What does this mean for continued participation and replacement of the beneficiary within the BAC if they cannot continue participation? Kathy, from my understanding, and please correct me, that member can still continue to serve even if they do not, if their determination ends or their eligibility ends, they would still have access to the BAC to still serve because they were a beneficiary at some time.
Correct. You're either current or previous.
Yes. All right. And would the MAC be for local DSS agencies to provide feedback as well? Yes. Yes. All right. This is another question. Will the immediate family members become eligible to take care of each other? This is so much needed. I'm providing home care with the new MAC BAC. I will say that if you are an immediate family member, that you're able to apply for the BAC, but I think this may be another question is there that I think that we'll take offline to make sure that we get this answer. I'm going to submit our contact information to make sure that I fully understand that. But if you are an immediate family member who is interested in serving, yes, you can apply for the BAC and you can serve on the BAC and you can apply. Will there be an interview? Kathy, have we added an interview portion to the application?
No, not yet.
I don't think so.
I'm sure that yes, there will be some type of interview.
Okay.
Just haven't gotten that far.
All right. All right. I am a MAC member. Do they need to accept Medicaid as they provide services? No, you do not have to be a provider that accepts Medicaid. However, we encourage you to. All right. Did you say participants are paid? Yes, we are working towards compensation for participation. All right. Will there be a tax sheet or something that could be concrete evidence? Yes, there will. Yes, if you are a participant, the Department of Revenue is expecting to receive taxes as a part of that. So yes. And what is the estimated time commitment for the MAC and the BAC? We do note that for the MAC, currently our MAC meetings have been 3-hour meetings. We have held them on Fridays. We do expect for the back to be the same, probably about 3 hours, because one, there's a lot of topics, because this is considered what we call a quarterly meeting. They meet quarterly to have these meetings. And so there's quite a bit to discuss during those times. So there is a 3-hour commitment if you serve as a part of the MAC, 3-hour commitment if you serve as a part of the back. So if you decide to serve on both, just note that that is probably a 6-hour commitment quarterly. All right. And I think I have gotten through all of the questions. I don't see additional questions that have come up. But again, we do thank you for being a part of today's session. A copy of today's slide deck, as you see, it has been posted the whole time. And the recording will be available on our website. But if we did not get to your question, or if you need more clarification on anything that was shared today, feel free to email us at medicaid.ncengagement@dhhsnc.gov, and we'll make sure that we get those questions answered. Again, thank you for joining us. You've had a lot of questions for us today. Hopefully we were able to get those questions answered, and we look forward to you applying. Again, those applications will be posted. We'll make sure that we send out emails to everyone on the call, and those who have missed the call and you're listening to the recording right now. Make sure you get those applications in. So we look forward to reviewing them. And again, just thank you for being with us. Bye.